Supervision. Supervision is a key component of your job. You will be supervising many people, and you have to know how to do it correctly, because there are right ways and wrong ways. We've all been on the receiving end of bad supervision. Well, maybe we all haven't. I have. It's not good when you are being poorly supervised, when you're not getting feedback, when you're not getting good communication, when you're not getting specific communication, when you are given assignments that are not within your scope of practice. Those are challenges to good supervision. So, what determines how you supervise and how the type of supervision? Well, again, what does your patient need? How stable is your patient? How competent is your delegee? What task are you giving them? And the availability of supervision. Again, those are all components of that will fit into how you supervise the person. If your patient is, had a knee replaced and they're 2 days post-op, they're going to be going to the nursing home later today, minimal supervision if your staff is accustomed to working with knee replacements, right? If your staff has never worked with a knee replacement, you're going to need a lot more supervision. That all makes sense, right? That's pretty common sense. Accountability. I don't know if you can read that. Let's see if we can make it a little brighter. Accountability, that's a little better. What does accountability mean? Let's go to the definition. Being answerable for what one has done and standing behind that decision and or action. Being answerable for what you've done and standing behind it. You can be answerable and not stand behind your action, right? And how would you feel about a leader who does that? In my opinion, that's a weasel leader. When I do something, when I give an assignment, and Nick goes down the toilet, my responsibility, I'll stand up for it. I gave that assignment. I took that action. My fault. And then I learn from it and try never to repeat that again. So accountability. As an RN, you will be accountable for your actions as well as the actions of everybody underneath you. Evaluation. Evaluation is a major component of your job. You will be evaluating everyone around you and all of your delegees. You need to be able to evaluate fairly, objectively, and based on what that person can do, not necessarily what you can do. Does that make sense? When I have students in the clinical site, my skills as an RN, I've been an RN now for 18 years, my skills as an RN are generally higher than that of my students. That's appropriate, right? I'm quite good at starting IVs. I used to work in an ER, started a lot of IVs. Do I expect my students to be as competent as I am? No. No. I expect them to try and do the best they can do every time they try. But I don't hold them to my standards. But when we're giving a bed bath, they can give a bed bath as good as I can. And possibly better, since they may have been giving them much more recently than I have. So then I do hold them to my standards. So you evaluate your people differently based on the situation. Now, does that mean as an instructor, I let my students have, I cut them too much slack. No, I hold them to the correct standards of a student, which means they can make mistakes. They can learn from mistakes. They can grow their wings. And I understand that. They're learners. But when you've demonstrated that you've learned something, now that is a demonstrable skill that you have, and the bar has now been raised to that level. So what happens when I evaluate a student or staff member and there's problems? You need to take corrective action. Corrective action. Oh my gosh, that doesn't sound good, does it? You know what? We will all be on the receiving end of corrective action changes. We always will. There is no one out there that will never make a mistake. Never. Just won't happen. So you will always be receiving corrective action suggestions. Training and education. So when I see a student make a mistake with an IV start or make a mistake, let's say they don't wash their hands as they walk in and out of a room. And at the hospital that I work at, there is alcohol dispensers right inside the door of every patient's room. If my students do not go and wash their hands walking in and wash their hands walking out, we take immediate corrective action. I educate and train. It's the first step. And that should be the first step in almost every situation. Find out what the person knows or doesn't know, and take corrective action by changing their action, teaching, selling. Because generally, changing an action requires that you convince the person why they need to make that change, and you have to be right alongside with them. Selling behaviors. Restate the expectations. Okay, student Susie, if there's any Susies out there, I'm not naming you in particular, just using that name generically, right? Student Susie, my expectation is you wash your hands when you walk in and walk out. That's also the expectation of the hospital, the school, the Joint Commission, and pretty much every organization out there. The expectation is wash in, wash out. That's it. I've stated the expectation. I might say, show me that you know what I'm talking about. So ask for a return demonstration. Not always necessary, but especially when it's a mechanical or bodily kinetic activity, that's a really good way of understanding if the person's learned what you're talking about. Show me what I just said. Identify specific checkpoints. So I'll go, okay, student Susie, you've shown me that you know how to use those machines. I'm going to do spot checks for the next few days. I want to make sure that you've retained this new skill. And I might do that more frequently with her or him versus other students, especially if other students have demonstrated the skill. And then, after the appropriate amount of time, I may pull her aside and say, nice job. I've noticed an improvement in your hand washing skills, that you always are now washing in and out. Good job. Corrective action is a cycle. Educate and train. Make sure that the person understands the expectations. Return skills, return demonstration. Specific checkpoint times and increasing cycle of observations, and then evaluate for changes in behaviors. Now, what happens in different leadership styles when there's poor performance? Think about that. Remember we talked about the four styles, the participate, the delegate, the selling, and telling. How do those four different styles impact leadership and leadership in poor performance situations? Well, selling, talk about selling. We just used that as an example, where I need to convince my person of why they need to take the correct action, and I'll be right alongside them, making sure that we were both on the same page. That's selling. That is that can be a very effective leadership style in terms of improving performance. How about telling? Can telling improve performance? Sure. Susie, you need to wash your hands every time you walk in and out of a room. That's it. It can be done. What of those two styles, which would you choose for something like hand washing? Probably telling, because it's pretty simple. When would you choose selling? When it's a more complex problem, when it's a problem of fundamental differences, when it's organizational changes, that's when you would do a selling approach. Participatory leadership would be the manager saying, hey, let me show you how I do things. So the manager leads by example. How about delegate? Delegatory improvements? Again, just tell them what needs to be done, and that's you just work it out. Now there's two sources of potential problems: systemic and individual. Let's take hand washing for an example. There have been studies that show 30 to 40% of people who go in and out of rooms do not wash their hands. Is that a problem with the person or a problem with the system? I think it's a system problem. See, if everybody but one person washes their hands, that one person, it's an individual problem. But when more than half of the people are not washing their hands, that's a system problem. And you have to approach those two types of problems differently, obviously. If it's one person, you can go down to that telling and say, with that finger in the face, you just got to go, boom, wash your hands. End of story. You can even go, wash your hands, or else. Throw that or else in very quietly. That kind of freaks people out. I hope you're getting the humor there. That's one person. But when more than half of the building doesn't wash their hands, and I'm betting you've seen this in the hospitals where you've done your clinicals, you can't go up to the entire hospital and tell them and use the telling approach. You're going to have to do some selling. You need to sell to the entire staff of why they need to wash their hands, what will benefit them, how the entire facility will benefit, how their patients will benefit. That will require more work, but it will also yield better results because people will buy in to what you're trying to tell them. Now, going back again to that hand washing example, let's say that it is a system-wide problem that more than half of your staff is not washing their hands. So we have a system-wide problem. We need to change the system. And there's an actual theory called the change theory or the change cycle. There's 3 steps to the change cycle. The first is unfreezing. What that means is you're going to go into the group. You may have large group educational meetings. You may probably will have a series of them. And you need to start selling on why they need to change. You're going to unfreeze current habits. You're going to explain why hand washing is so critical, the benefits that the hospital, that they will receive, that the patients will receive. And hopefully you try to say that the patient benefit is most important, but we also know that there's a benefit to the hospital and the person. So you're going to be giving information. You're going to involve people. You're going to get both hand washers and hand non-washers together to come up with strategies to get more people to wash their hands. You're going to acknowledge that this is going to change their practice. You need to acknowledge the loss. What loss? Well, the reality is it takes a little time to wash your hands. Doesn't take much time, but it takes a little time. And if you are in and out of say you're a CNA with 12 rooms in your assignment, and you go in and out of those rooms, each of those rooms twice an hour. That's 24 times you have to stop and wash your hands in and out. It will slow you down. You have to acknowledge that loss. Then you need to change. So you've unfrozen. You've made the entire staff aware of the need to change. Now you need to change. It's going to start high task, high relationship. You're going to be selling. You're going to actively promote change. You're going to be all over these people. You're going to be following them. You're going to be giving them feedback. Oh, I saw you wash your hands. Good job. Or, oh, you didn't wash your hands at that time. Come on. So you're going to be there. You're going to be observing. You're going to be pointing out successes and failures and rewarding people and acknowledging that there's rooms. Try that again. You're going to be rewarding good behaviors and acknowledging that there's room for growth in other people. It's a very busy time, but that's the change part. Now you've reevaluated and you've went from a 40% hand washing rate to 90% hand washing rate. And now refreeze. By this point, hopefully you've established a new habit system, a new pattern where you've recognized success. You're now doing low task, low relationship, the delegating section. You don't need to follow up people anymore. You don't need to give them a constant pat on the back for success because they've internalized it. You've incorporated these changes into new patterns. Yes, it's slowed them down a little bit, but maybe they've learned compensating mechanisms to keep them even faster. You've learned that the hospital has financially benefited from this, that patients have benefited. So you refreeze. Unfreeze by explaining why the change has to happen. Change. And then refreeze when the changes have become the new norm. Changes will happen all the time. I'm certain that in your job you've experienced many changes. It'll happen. It's going to continue to happen. It's a challenge because especially when people have entrenched habits, that unfreeze is very difficult. We've all worked with that person who says, nah, I'm just not going to do that. You know, that's the selling, the high task, high relationship. You might have to actually sometimes go down to telling. You may just have to end up saying, you will, or else. You don't want to have to say or else very often, but sometimes, right? When you're working with that person who needs the or else, it's important that you have a set standard approach. It can be very confusing for people if you use a more random method of approaching problems. For example, those of you who are maybe my students in clinicals, when there's a problem, I will almost always say, we need to have a talk. I see a problem, we need to have a talk. That's my cue to you saying, we're gonna have a specific and serious talk about one problem. Make sure you tell the person that they're important. even if they're making mistakes, they are important. That's key. The person doesn't have to be doing perfect work, but they're still important. And then clearly state the problem. Go back to the hand washing. Susie, I've noticed a problem. We need to have a talk. I'm really glad you're one of my students. You've been a great asset to the team, but you're not washing your hands every time you walk in and out of a room. Can you help me understand why you've chosen to not follow that guideline? Because there might be a reason. What could be a specific reason in this specific example? Suppose they're allergic to the hand washing solution. Possible, right? Would that be a reason to not wash their hands? It would be a reason to not use that sanitizer. You still have to wash your hands. But if I don't know that you have that allergy, if I don't know that, I'll end up jumping to a conclusion that would be incorrect or inaccurate. So then, okay, so you're allergic to the sanitizer. What can we do? Hopefully the student realizes that there's a sink in the room and they can use soap and water. They may need to bring a special sanitizer from home. They may need to find a different job. You know, there's a range of solutions. Suppose they decide to bring a sanitizer from home. So we agree on the problem, we agree on the solution to this problem. Now, that may be enough. When you're an employee, you may have to have a more concrete piece of evidence. There may need to be a written summary of your discussion, a written warning. And that could also go for students. There could be a write-up on your weekly grid saying, this problem was noted, but we've discovered this solution to the problem. Set up a review. I'll say, Susie, bring in your sanitizer from home tomorrow. Let me take a look at it. Or let's have infection control look at it, make sure that it's going to be adequate. And then, thank you. I'm glad we had this talk. I'm glad we were able to handle this problem now rather than wait for it to get to be a bigger problem later on. And that's it. Move on. Evaluate for compliance with the new plan, but then move on. There's no reason to keep rehashing an old problem. We're going to come back for the hopefully the last section on dealing with impaired nurses and impaired coworkers.